Okay, let's talk about these ACL and PCL injuries. ACL injuries, these are going to result in the anterior tibial translation, and the PCL is the posterior tibial translation. And when you see an MRI that looks like this, you have to think the fibula is on the outside laterally. Okay, so we had a 27-year-old male, pain and swelling, maybe some bleeding. There's a fusion, and the positive posterior jaw test that tells us it's the PCL. And so we're going to have to find that ligament and be able to identify it on an x-ray. So there's the lateral side. That's the important thing that we need to know if this is like a coronal view. So which structure is injured? It's going to be the posterior cruciate ligament, and let's talk about this. So the PCL tear, direct trauma to the anterior tibia, so a fall and a flexed knee, and the positive posterior drawer test in which the tibia moves excessively posteriorly when the knee is flexed at 90. And it causes a fusion, that's why you get the bleeding of the joints. ACL runs in the opposite direction as the PCL and prevents the anterior displacement. And so it's caused with sudden pivoting or movement or direct trauma, and it has the positive anterior drawer test. The lateral side protects against the varus or inward forces, and it connects the lateral epicondyle of the femur to the fibular head. So the fibula is on the outside. That's important to know. Varus stress test, increased lateral gapping is expected in the LCL tear. Okay, and here's a good little illustration of our varus versus our valgus forces. So here we have our varus and then our valgus. Kind of take a look at what that might look like here. Okay, and then the MCL stabilizes against the valgus, the outward forces. So this would come from a direct lateral blow to the knee, and it protects you from those outward forces, and a positive valgus stress test would show you that you have an MCL injury. And that's pretty much it. Just knowing these tests and these common injuries and identifying them on a coronal view.